Healthcare and health insurance in the United States are absolute scams. Like, we all know it's bad, but some of these stories, they are on a whole other level. People getting charged a fortune just to breathe in a hospital. It's insane. So today, we're diving into the wildest, most ridiculous experiences people have had with the US healthcare system. All of this is just for educational, entertainment, and conversational purposes only. A disclaimer. That's what you need to say these days.
If you needed more evidence of how the United States healthcare system is, this is it. Literally at my doctor's appointment right now, waiting for the doctor to come in, and I'm filming this because I'm so worked up about it. I just had to sign a consent form when I checked in saying that even though this is an annual preventative visit that I normally wouldn't have to pay a copay for with my insurance, if I bring up any issues with the doctor, it then becomes a sick visit and I will be charged a copay. I don't know if this is a new policy or if it's always been a policy and I just didn't know about it, but what the is the point of having a preventative checkup if you can't bring up issues that you have
That's right.
with your body? Fortunately, I don't have any issues today. And even if I did, I am very fortunate and I would be able to pay for the copay. But that might be a deterrent for some people who cannot convince me that they are not trying to keep us sick in this country. You can try, but you will not convince me otherwise.
This is ridiculous. Like, what's the point of paying health insurance if you can't bring up any concerns about your health with your doctor because you're going to get charged if you do? That's ridiculous.
So I don't normally jump on that health insurance is a scam, but today it is absolutely a scam and I swear it's fraud. I need an MRI on my back because I hurt my back. My clinic sent it over to a hospital. They ran it through my insurance. They called me and said, hey, your portion of it that you're going to have to pay after insurance is $5,100 for this MRI. So I'm like, wow, okay. I was like, before we do that, like, just wait, because I'm like, $5,100 just seems wild. I called another place who was also waiting for my insurance to go through to see how much it was going to be. My insurance was still on hold with them, but I asked them, hey, if I just cash pay this, how much is it going to cost for this MRI? And they're like, well, if you just want to cash pay it, not run anything through insurance, it's $700. And so I'm like, sounds a lot better than $5,100. So I called the original hospital back and said, hey, if I don't run this through insurance, what is the cost if I just decide to self-pay it, since I know the other place is $700? The lady's like, I'll rerun it under you being self-pay and I'll call you back with your total. So a few minutes go by, the lady calls me back and she goes, hey, I talked to my supervisor. Since you have insurance, we are not going to let you self-pay it, so we won't give you that number. How is that not a scam? Is it my choice if I want to self-pay something versus running it through my insurance? How I should get to decide that, not you, but they're like, nope, since you have insurance and you've already done it that way, we are not going to allow you to self-pay it. And I think that's because they probably were going to give me a self-pay price, kind of like the other place, maybe a $700, maybe up to $1,300, still way less than $5,100 that it was going to make me pay. And I just think, like, what if, somebody wouldn't, like, what if I wouldn't have called around? I would have been stuck with this $5,100 bill. Insurance is such a ripoff. I don't know how in the world this hospital is telling me that I now can't self-pay it. What does it matter? I'm going to go to the other place, but I don't know how this hospital is allowed to now tell me, hey, yeah, you can't self-pay something if you have already had us run it through your insurance. I haven't even had it yet.
This is absolutely crazy. Health insurance here is a scam, and you cannot convince me otherwise. We've lived here for 3 years now, and we haven't had health insurance here in the United States because when I just got here, nobody could explain to me how health insurance worked here. Each time I would ask for a quote, I would get a different quote, and the amount I would have to pay would be just ridiculously high. I could not afford that. I cannot afford it even till this day. Every time I ask for a quote, it's a different number. Like, it's just, and nobody can explain anything to me. And the minute I got here, the minute I started researching about health insurance here, I knew that it was a scam because I come from Europe and it doesn't exist there. Healthcare is pretty much free. You have to pay, of course, for some treatments. But if you go to the hospital and you need to get an emergency surgery, it would be free and you'll be fine. And her situation is just, it's just mind-blowing to me, because $5,100 with insurance, it's crazy. And then $700 without insurance. There cannot be such a price difference in the same test or treatment that she's asking for, and this is for the same person.
My daughter is 3. She was born with a heart defect. And long story short, she's had a couple of surgeries to try and correct it, but we still deal with low oxygen from time to time, especially when she's sick. And last month she was sick. We have oxygen at home we can give her, but it got low enough that we thought we need to take her in to make sure we're not missing something. So we took her into urgent care. And from there, she was admitted straight to the hospital, where we discovered that she has RSV. And they decided that it was worth keeping her so they can monitor and give her oxygen until she gets over the virus, and then she can go home. She got the oxygen that she needed. She did recover in a few days, and she did come home. This week, our insurance company informed us that they have decided that the oxygen that she received was not life-saving care, so they're not going to cover it. To be clear, the only reason that she was in the hospital was to get
I was just about to say that.
the amount that we were charged for oxygen that our insurance company is not going to cover is $18,000. I'm not going to say the name of our insurance company, but their initials are UMR. We pay our premiums on time every month, and we even put money away into a health savings account, but not
This is
like
insane.
that. So while I'm livid that we have to fight just to get them to pay for the things that we've already paid for to save my daughter's life, I'm also mad at the hospital. Why does oxygen cost $18,000? This isn't some precious mineral that we're mining in the Congo. It's literally everywhere. I haven't taken a breath that didn't have some oxygen in it in my whole life. I've had a glass of water that wasn't a lot of oxygen. Like it's everywhere. When she was in the hospital last month, that was about the time that this app went down. It was not available, and a lot of us looked at China's Red Note app. But more than looking at the app, we were discovering Chinese people, and they seemed very friendly, very much unlike what we were taught about them. What struck me is that there are 4 times as many Chinese people as there are Americans in about the same amount of land. And somehow they have figured it out so that if you're in China and you meet a Chinese person, you may not know their name or where in the country they're from, but you already know something about them. You know, beyond a shadow of a doubt, that they are not awash in medical debt. We like to tell ourselves that America is exceptional, and in many ways it is. But how is it that China has figured this out? That
Not
everywhere they
just
go,
China.
they run into people, and not a single one of them has declared bankruptcy or is on the verge of insolvency because of medical debt. And like many Americans, my wife and I went into debt, in student loan debt, just to have the ability to buy premiums to cover ourselves and our family and insurance, only to then be given more debt by these same companies when they just decide they don't think that oxygen is life-saving care, even though it was the actual reason that we went to the hospital. Many of us are working our entire lives to save up money, not so that we can give it to our families, just so that we're not giving to our families tens of thousands of dollars in medical debt when we leave. Is that what the American dream has become? Working your entire life, going into debt for the hopes that you can get out of debt so that you don't leave a mountain of medical debt for the people that you love. That's the American dream, just to bust your ass every single day so that you don't leave debt for other people. That's it?
I have so many things that I want to say about healthcare and health insurance here, and I just can't because it's just going to take forever. But my biggest issue is, what's the point of paying for health insurance if any of your treatments can get denied, and then you get these huge bills that you still need to pay, and then you need to sit on the phone for hours arguing with your health insurance provider about them not wanting to cover your treatment. This is just ridiculous. They use this word insurance. So if I pay health insurance, that should be enough. I should be covered. I shouldn't have to worry about any of these things. You should deal with all of this, with all the bills and everything. I shouldn't have to sit in the hospital with my child and worry that you might not cover my child's treatment. And I shouldn't have to worry about going and calling you and sitting on the phone with you arguing about these things. Healthcare is a basic human right, and going bankrupt over receiving a treatment or a life-saving surgery is absurd. There are definitely things that people can do without, like certain procedures or tests. But let's say you get into a car accident and then you get charged like $500,000. That's just insane. Nobody chooses to get into an accident. And even if you choose to undergo some kind of treatment, it shouldn't cost a ridiculous amount of money.
Cleveland Clinic, you should be ashamed of yourselves. For example, I come to your ER for excruciating kidney pain, and you put me in a waiting room for 8 hours. I finally get to see a doctor, and the doctor says, "Oh, we're going to send you for an ultrasound." That's funny. I already had one. The nurse rolls me over and I'm like, "Are you sure I really need to get this ultrasound? I just got one earlier today. And you guys have all the paperwork on it. You've already looked it over the notes." So they wheel me over to the other side with imaging. I'm about 2 minutes in. The radiologist is doing my scan. She gets a phone call in the middle of my scan. She takes off her glove, answers the phone call, and she goes, "Oh, seriously?" She hangs up. She goes, "They've just canceled the order for this ultrasound." I said, "Oh, yeah, they probably realized they didn't need to do it." She goes, "But I'll just finish it anyway since I already started. Why would they charge me?" I tried to fight it, and they said, "No, you already got it done. Since you got the scan done, you have to pay for it." I said, "But it was unnecessary. It was called to end. It was canceled. Canceled means no money. Nope, $1,800, and I'm past due on a payment, and I'm like trying to put my foot down. I've already called like 5 times, and they finally got me in touch. They said they had put the case through, and the case got denied. I got denied. I have to pay $1,800 for a canceled ultrasound. That is so messed up.
$1,800?
Be ashamed of yourselves.
I have no words. Just one. Ridiculous. I'm gonna say this word like 1,000 times during this video.
So I'm going over my medical bills for the year. July 2nd, I had a spinal fusion and disc replacement of my L45, L5, S1. My hospital bill was $221,219. Anthem Blue Cross paid $22,217. My surgeon, who actually worked on my spine, his bill was $199,724. Anthem paid $972. That's it, $1,000. The anesthesia, $28,600, and Anthem paid $1,299. The biggest one is my vascular surgeon, who was out of network with insurance. His bill was $397,034.20, so almost $400,000, and my insurance paid $1,515.
What's the point of paying health insurance? You're just wasting your money.
Must be super naive because I thought baby was free. I thought when you went to your hospital to have your baby, they charge you for all of your things and that the baby is just part of you and that they're considered free. I was so wrong. After months and months of finally paying off all of the hospital and prenatal and delivery payments, all that stuff to the hospital, I was like, okay, cool, we're done. Check it off my list of things to do. No, a couple months later, it was like, "Oh, you owe $1,682 for someone named Callie." And I was like, wait, I'm not Callie. That's my daughter. So it turns out on the day I actually had her, someone walked into the room to look at her, and that was $760. And then the day after, someone walked in to look at her, and that was $336. And then the same day, someone else came to look at her again for $250. And then on the last day of checkout, $336. So a total of $1,682. This was just a little heads up so parents don't realize it at the end. Don't forget, you got to pay for your baby.
This is mind-blowing, like literally. I know that in Canada, giving birth is free, and in Europe, of course, it is free. I gave birth to my son in Ukraine. I'm from Ukraine, if you don't know. And I paid approximately $600 for everything, and just because I wanted a specific doctor to deliver my baby. And also we like pay for like little things here and there in the hospital. But in total, it was $600. And if I didn't want to pay anything, I wouldn't pay anything. I would just go to the hospital and deliver my baby and just go back home. And yes, a lot of the hospitals in Ukraine are old, and you might not get like an individual separate room just for yourself. I didn't get one, but that was okay. Like, I mean, $600 and let's say $20,000 or $50,000, again, because it's different for everybody. That's a huge difference. That's a huge difference.
People are not going to fucking believe this. Just yesterday, I made a video saying that we should have had Medicare for all in this country 80 goddamn years ago. And the only reason we don't is because every single one of our health insurers are greedy, blood-sucking parasites. Well, just this morning, I woke up to an email from my health insurer, Anthem Blue Cross Blue Shield. In that email was an explanation of benefits saying that I owe $12,000 for some lab work I had done back in September. Now, it's true, in September, I had a doctor's appointment, and when I made that appointment, I was very careful to choose a doctor that was in network at a place that was in network. During that appointment, they said, hey, do you want to do some lab work? I said, yes. I thought it was part of it. No one explained that it was going to cost me $12,000 to get this lab work done, and the lab that they used to do that lab work was apparently not in network. And now I owe $12,000. All right, for 12 grand, I could fly to Paris, get the lab work done, spend 3 months in Paris doing whatever it is Parisians do, eating baguettes and sighing non-committally, I guess, and then come back to the United States. This entire country sucks. Everything about it is a goddamn con designed to take money out of your wallet and put it into the wallets of people who are vastly more wealthy than you could ever goddamn imagine.
Another great point. Like, you should always check if your doctor is in the network and the hospital you get into is in the network. Like, I came to this country, I didn't even know about any of these things. I thought if I go to the hospital and I have my insurance, I can go to any hospital and talk to any doctor. But, like, it's a scam. Ugh.
So you accept my health insurance, correct? Yes, but you're out of network technically. I don't understand what that means. You can use it here. It's just going to be more expensive. Okay, whatever. You can get me the medication I need to stop my headaches, right? Yes, but no. Yes, but no. First, I have to give you something that probably won't work. And then after using that for a while, when it doesn't work, I can maybe get you the medication that does work. Okay. If that's how I have to get it, just call it into this pharmacy. You know, I don't think that pharmacy accepts your insurance. They don't. But they're a pharmacy. Yeah, they're just not in contract with your insurance company anymore. Okay, can you maybe call and check with the one across the street to see if they accept my insurance? I can't do that, sorry. So how do I know if they accept it or not? First, you have to go try to pay for it. And then when you try to pay for it, you'll find out whether your insurance covers it there or doesn't. Okay, and then I can finally get the medication that works after that, right? Yes, after you see a specialist. A specialist, okay. But at least they're in network with me, right? Actually, none of the specialists here take your insurance. So I just have to pay out of pocket? No, they only work with people that have insurance. Then what do? I have no idea. I'm just a doctor. Wow. Okay. I must just be a really rare case then. No, this happens all the time, actually. So it's just a broken system then. What? No, the system works exactly how it's supposed to, but it doesn't help the people that need to use it. Exactly. This is how it was designed to work.
And this sums it up. This is just ridiculous. Oh my God. Oh, just listening to this made me infuriated. How can this be real? I don't understand. And the thing is that the healthcare in the US is definitely not the best in the world, despite of what you've been told or convinced.
Here's how much it costs to have a baby in America.
More specifically, in Nashville, Tennessee.
So we're going to start with the ultrasound that we had to get a couple days before Aspen. So that ultrasound cost us $2,067.85.
Just to make sure
an
the baby was
ultrasound.
okay.
And now on to my actual hospital stay. So
Mine
we
were free.
stayed for just under 3 days.
So whatever the observation room is, we got charged $413.65. No
My-
clue what that is.
My guess is maybe triage. You know, they were observing me.
The recovery room cost us $2,702.45. A hospital stay, I don't know how that's different, but that one cost us $4,438. The emergency room cost us $1,932.90. And I don't know what the laboratory is either, but that cost us an additional $1,439.20.
The only thing I could think of with the laboratory is like maybe like my IV that I had. I don't know. But then we go into labor and delivery. So this one is the one where I would expect it to be the most expensive because that's clearly why we're there. We got charged $10,593.40 for that one. And then our anesthesia. So my epidural cost us more than anything else. That one was $14,446.15.
Was it worth it?
Yes. Yes. We also had a pharmacy and supply cost. So pharmacy cost $2,007.25. For supplies, $565.03. So the grand total for everything came out to $33,011.70.
I'd say that's not a
Oh,
lot.
That was just for our stay. We also had to pay for Aspen, our newborn daughter, to be in the hospital.
So her hospital stay to
Of
stay with
course.
us in the room that we also paid for was $4,008.
Our complete hospital bill cost $37,019.73.
Luckily, we have insurance, but insurance only helps so much. So how much we have to pay out of pocket to have a baby in America is $11,558.93. Was it worth it? No, I'm just kidding. I'm kidding.
Awesome.
Yes, it was worth every penny, but she was an expensive baby.
It's a lot of money.
I don't understand, guys, and I'm talking to Americans. How can you be okay with this, knowing that this exists literally nowhere else in the world, just here, and they're getting scammed? Like, how can you be okay with this? You deserve so much better. Americans, you deserve so much better. I'm appalled for you.
I just want to hop in and share my story of insurance as a scam because of the video that's going around on TikTok right now of the family in California with the ambulance bill. I just want to share my story of insurance as a scam. I was supposed to get a surgery about 2 years ago. It was for quality of life. It wasn't essential to me being alive. It was a purely quality of life surgery. But I found a doctor that would do it. Jumped through all the hoops to get to the point where I could have all my like pre-op appointments. Like I was days away from my surgery date, and I was trying to finalize the cost of this surgery because nobody had been able to give me a solid answer. So I finally was a few days out from surgery, and I call the billing line one more time to just make sure everything's good to go and my insurance is fine and everything. And they were basically like, no, it's not. And with insurance, I would have been charged $14,000 and change for the surgery. But then she said, but if you didn't have insurance, it would have only been $1,900 because we give a discount for those that are uninsured. Why do I even have insurance?
What? Make it make sense. This is... Oh my gosh, mind-blowing.
How can I help you?
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
That's a real phone call.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
Yeah.
No, so you're insured, so you're not eligible for the discount.
How does this make sense?
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
But this doesn't make any sense.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
But what's the point of paying health insurance?
Is this common?
Having
Like I pay for insurance and I end up paying more out of pocket
Aren't you supposed to
because
pay
I
less?
pay for a premium? That's wild.
No, this is just a new law that passed or started 2024 AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just if I have the incentive straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir.
You
should cancel your insurance.
Of course
I'm
he
just
doesn't.
letting you know that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that discount onto an insured person. Only the uninsured people get that.
No, correct.
But aren't you supposed to pay less if you pay health insurance? This doesn't make any sense. This is infuriating. Who else is mad right now?
The bill for the ride in the ambulance is $1,000. Oh, sorry. I actually have health insurance now. So, okay. Let me put that in really quick. Thanks. That comes down to $4,000. What? It went up? Yep. What? Do you have your health insurance card? Yes. Here you go. Okay. Thank you very much. Here you go. And that'll be $75. But no, I have health insurance. I just gave it to you. And you have a $75 copay. But I'm covered by insurance. With a $75 copay. Hey, you were supposed to cover something since you're my insurance and I pay for it, but you didn't. And now they're charging me $7,000 for this. So can we fix this or what? Absolutely. You just need to call 7 or 8 different people and talk on the phone for 4 to 5 hours to get something covered because we intentionally didn't cover it knowing that we have to cover it, but we're waiting for you to do all this work so that we eventually cover it. We're hoping basically that you give up and you end up paying out of pocket so that we don't have to pay for it. So this office is in network with my insurance, correct? Yes. Okay. And so is the doctor that I saw. He's also in network. Yes. Because I know that some of them are not, but he is. Yes, he is. Okay. But the bill that I got from the tests that were done were not covered by insurance. The lab we sent them to is actually out of network. So, no.
What? An elderly woman with cancer in Alabama was sentenced to prison for robbing a bank. She was diagnosed with cancer but didn't have any money to pay for the treatment, so she was going to pass away rather quickly, but she was a fighter. So she said she was going to go rob a bank, and if she got away with it, she would then have the money to pay for the treatment. And if she didn't get away with it, they would sentence her to prison, where then she would get treatment from the state. Granny said either way, she was going to be living longer, baby, because she still wanted to keep kicking. When the judge asked her if she was sorry for her actions, she said, "No, I'm just sorry I live in a country that thinks it's better to spend money on bombing the Middle East for the last 30 years rather than take care of the health care of its own citizens." The judge asked her, "You have no other way to pay for this cancer treatment?" And she said, "I would have another way if I could get the insider information that the politicians get to buy stocks and make a bunch of money off of non-public information. Then I could make some money to pay for it. But since I don't have that, I got to go to prison now." So she took that 6-month prison sentence with a smile and says she'll be back for seconds if she needs more treatment.
What a brilliant lady, and what a brilliant idea.
There should be a law that if an insurance company denies your claim for a life-saving treatment, that they have to refund every single premium that you paid to them. Because if they can't save your life, then they shouldn't get to keep your money.
Yes, exactly this. You know, every healthcare system in every country has its own problems. None of them are perfect, but at least going to the hospital in other countries won't leave you bankrupt. America, you deserve better than this. Seriously. Anyway, leave your thoughts as always in the comments and share your stories with us. And come back for part 2 because there's gonna be part 2.